everybody, this is Dr. Greg Persley again with PC Medical Centers in Cape Girardeau, Missouri. And today I'm going to teach you 4 simple stretches that will improve your shoulder range of motion and reduce the risk of arthritis and degeneration inside the shoulder. Look, shoulders are something we treat on a regular basis. It is the most mobile joint in the body, which means it is the least stable. So the more mobility a joint has, the more range of motion potential it has, the less stable that joint is. We do a lot of injections on shoulders, non-steroid injections. We do things that help improve the function of the shoulder, like therapy, adjustments, and injections that are more natural. And the reason why we do that is because if we improve the function of the joint, then it is not going to break down. It's when the joint stops functioning that it degrades or degenerates. See, if everything in your body functions properly, you don't have problems or symptoms or degeneration or arthritis developing in that joint. If it stops working properly, that's when you develop degeneration, arthritis, and damage that occurs. So these will help your joint stay functional and stay mobile to reduce the risk of degeneration and arthritis in that joint. Obviously, if you have any of those problems currently going on, the quicker we can get those looked at, the more likely it is you will be able to get those treated and reduce any further damage or degeneration or arthritis in that joint. All right, if you're interested in that, feel free to click the link. We are offering free consultations. Our case manager will help you get to the bottom of the problem, and then we'll do an exam. And then our process is that you will meet with our entire team, multiple providers will look at your situation and see how we can help you, and then present you with that solution so you know everything about the issue and how we can help it and all the options that are available. But here are the simple stretches. There's basically 4 positions you're going to get in with your arm, with your shoulder. Depending on your current situation, depends on how hard you should push into these. But for stretching, what you want to do is you want to do it nice and simple, slow and steady. We don't want to do too much at one time. Stretches are best done over a period of time and more repetitive in nature. So we're not going to go from a little range of motion to a lot of range of motion right off the bat. We want to do that over time. I recommend doing 5 seconds and doing each of these 10 times every single day. 5 seconds, 10 times. There's only 4 of them, so we're going to go over them real quick. First of all, you've seen the one, your range of motion in your shoulder has basically 4 major ranges of motion. You have up, we have in, we have out, and we have back. So what we're going to do is we're going to do stretches on those 4. So the first one is we're going to go across our body, pulling our elbow. You've probably seen this 1,000 times or more, especially at Little League baseball games, but you're just going to pull as much as you can. We try to do these what's called passively. Passive means you're not actively reaching, you're trying to let this arm go limp and imagine somebody else is pulling your arm across. You should feel this in the back, up into the shoulder and scapula area. That's number 1. Number 2 is you can reach your hand above your head. Now you can use a door frame, you can use a wall. I'm going to use this wall right behind me to show you. But you're going to reach this arm above your head and you're going to go and walk your fingers up the wall and you're going to sink down into the wall slightly. And what that's going to do is it's going to stretch the front and you'll feel it in the back a little bit as well. So that's across and that's up. Now we're going to do out. Once again, I messed my badge up here. Once again, we're going to use a wall or a door frame in order to stretch this. You're going to take it, you're going to put your hand on the wall. If you can see here, I'm on the wall. We are going to use that and rotate our arm out. Our shoulder should rotate behind us as we're doing that. Now, a couple things to watch out for. If your wrist gets in this position where it's extended out, you might feel some stretching and tingling here in the front of your arm. Try to keep your wrist relatively straight when you're doing this in order to get the shoulder. But you're going to rotate, you do that 5 seconds. Then finally you can use a doorknob or a countertop, and we're going to reach our arm behind us. You're going to grab onto something, which it looks like I'm grabbing onto that. And you're going to basically take a step forward and your arm is going to stretch up behind you, okay? You can use anything for that you can grab onto, but you reach into that, you grab it, and then you sink down and your arm will reach up and back behind you. So that takes care of the 4 stretches. We've got across our body, we've got above our head, we've got out to the side, and we've got behind us. Once again, be very careful, and if you have any questions, feel free to either comment on this post, you can direct message us, you can give us a call, you can send us an email, or you can share this with your friends if you think that they will get some help from this video. We appreciate you watching. Share this with everybody. If you're interested in that free consultation, click the link. It'll take you over to our scheduling site, and we'll be able to check out what you have going on. It's totally free, no obligation, and we want to make sure you get the best function in your joint possible so it stops the degenerative process. Have a great day. Talk to you soon, and go watch all of our other videos that have all sorts of tips and tricks.